Tomorrow, the first of 5 major airports will begin Ebola screenings for passengers arriving from West American or West African countries. Now, this comes after a few U.S. flights were grounded when passengers became sick, and the most recent case was today. A plane in Las Vegas was quarantined on the tarmac when a passenger who recently traveled to Africa vomited on board. About an hour later, officials say the passenger did not meet the criteria for Ebola. Airports in the U.S. are preparing for a worst-case scenario, and hospitals are preparing too. Several local hospitals have plans in place, making sure staff members know what to do to protect themselves if a patient arrives with Ebola symptoms. Channel 4's Kamasi Aaron joining us live at UF Health Jacksonville with more on the plan there. Kamasi?
Well, Ken, people here at the hospital told me this is something that they have been working on. They have been training staff on for months now. And so they told me if a patient were to come here with Ebola symptoms, they feel confident that they would be prepared. This is gear nurses and doctors at the hospital put on before treating a patient with symptoms of Ebola. It's all part of a plan to be ready, a plan that starts even before a patient gets to the hospital. It's activated once emergency responders call dispatch to let them know a patient with Ebola symptoms is on the way.
We have screening policies in place because we want to know if they're brought by EMS that they're a risk, so we can protect the facility, protect our patients, and begin the right care.
If a patient comes to the emergency room on their own, they're stopped here, where they go through a screening process. If a person is determined to be at risk, they're moved immediately.
And this is where we would bring the patient, and the staff would be in the appropriate personal protection gear.
This is the isolation room. By the time the patient with Ebola symptoms gets here, the nurses are already in place with their protective gear on, all to protect themselves as they put the patient into one of these 2 rooms. Both have negative pressure, meaning air can get in but not out.
What happens is air comes under the doorway and it exhausts through a special vent on the ceiling. So that way this air supply for this room does not mix with the heating or ventilation systems for the hospital.
An alarm goes off if the seal is broken, and a ball visible here also lets staff know something is wrong. And as hard as they've worked on the plan, officials at UF Health say they've worked even harder to make sure everyone is ready to execute it.
We've been meeting for months on this, so it's been a really great experience to be a part of a big team that's being well prepared for something like Ebola.
And UF Health says they've been working with the Centers for Disease Control to help develop their plan. They've also been in contact with doctors at Emory University, where the first patients with Ebola here in the United States were treated. Reporting live, Kamasi Aaron, Channel 4, the local station.